better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Well, welcome to this episode of No One Told Me, the Airway Health Connection. I am so privileged to have a very special guest, one of our incredible patients, Emily. Thank you so much for being open and willing to share your story. Last week, you sent me an email just saying, I can't believe the difference in what I've seen. And I want to share my story. And that's why you're here to do that for us. So tell us a little bit about you and what led you down this journey and where are we now?
Okay. So it's hard. Like, do I start in present day or do I start chronologically? I think I'll start present day with what we were
Well,
just
who are you? What do you like to do? What do you need from your life?
Who cares
you
about
need
that
energy,
stuff?
you need brain power, you need movement, you need all the things that health requires. So, what led you down this path?
Yeah, that's a great question. Actually, my quest last year was building a new body, and I've been into mindfulness and posture stuff since my mid-20s when I found yoga. But even before that, I had been searching for it long before. And this was like the new frontier, the reason why my head was still moving forward, even though I had done all the things and I was in alignment and had done so much body work and all kinds of stuff. So I found my way to this through being diagnosed with a series of dental issues in my early 40s. And I always knew I was grinding, but I would go to the dentist. They'd be like, you're fine. I took good care of my teeth. I brushed my teeth. I did the flossing. And for a long time, I was fine. And then in my 40s, it was a succession. I had to have my first root canal, which they said that most likely was not due to hygiene issues. It was most likely due to trauma and the trauma of grinding. And then a few months, like maybe a year later, I then had an infection in my gum, which my dentist had to send me to a periodontist, a specialist who was able to remove it very carefully. But it was the whole thing because she didn't want to mess up my gums. I already have gum recession, which is another thing that was happening throughout my 20s and 30s. I had bad orthodontia as a child. I had 4 teeth removed to deal with the crowding in my mouth. So anyway, I had that happen. And then I also had, what was the last thing that happened? Trying to remember. I can't even remember all the traumas. I think I've blocked them out.
It's so much. It's so hard and it's like a lifetime, right? We get our teeth early and then we have to maintain them. When they're under stress, how much can they take?
That is such a good point. And they've been under stress my entire life now that I look back and I realize why, it's such a cliche that going to the dentist brings up this trauma, but it really was. It was due to having this tongue tie, not understanding my mouth, not understanding anything about the function of the mouth, and just kind of going with like dentistry that wasn't really great. And doctors that honestly, like I remember my orthodontist was a veteran, like a World War II veteran who like became a dentist. And
Wow.
I just remember being so young and hating him, like feeling so not empowered, waiting for hours. He didn't care. He was just so abrasive in my mouth. I was like this little child. And it started with, I was still sucking my thumb at age 7. So they had to that was when they intervened. So by then my jaw was quite developed.
Yep. And so for those of you listening, if thumb sucking creates problems past the age of 3, like we really should nip it as early as we can. But if we're just like telling people it's a behavioral problem and not looking at the reason it's happening, so it puts pressure on the maxilla, the upper jaw, and it also restricts the lower jaw from coming forward. So then you ultimately needed 4 teeth pulled because the jaws were so crowded and they missed it.
Exactly. Which I know now. I did not know then exactly. And I remember my aunt telling my dad, "Are you crazy? You're going to let them pull four permanent teeth?" And he was like, "What am I supposed to do? That's what they do." And so she, I think, intuitively also had that feeling like, why would you pull good teeth out when people lose their teeth when they get
Yeah, but
older?
you like they have trust in the person they're paying money to, right? Like your parents were doing the best they could with the information they were given. They weren't given an option for expansion. It was like, we're going to pull these teeth out and that's what we're doing. It's tough.
Exactly, which is, and it's also like it wasn't as known and widely known, and there wasn't the passage of information the way there is now, too. So I
For
think it was a lot
sure.
more common back then as well.
Yeah.
Whereas now I see parents are looking things up and much more aware. Yeah, that's a whole other tangent I can go on. But so anyway, I had these series of traumas. You get the idea. And then because of that was referred to an orthodontist from the periodontist who was like, you might want to work on fixing your bite. And so then I had remembered this myofunctional, Megan, and I asked the orthodontist, Dr. Baker, about it and was like, should I, and she was like, yeah, it can't hurt. Because I was like, why would I be moving my teeth if I don't fix the tongue function? And that has now something to do with it. So I went back to her. Scott was assessed for a tongue tie. And I was kind of like the whole time, I was like, it's kind of takes time to kind of buy into it because you're like, my
Mhm.
tongue was fine. I never had speech issues. Like, I was getting it, but I was just kind of like, I don't think it really sunk in.
And you've never
And
heard it before, right? This is the first time in your life it's been brought up. Like nobody talked about one of the reasons you could have been persistently sucking your thumb at 7 was because you weren't getting the sensory feedback needed by the tongue resting up there. So kids are smart, and you figured out, well, way easier just use my thumb because my tongue is working too hard to sit where it's supposed to. Like it's a compensation and adaptation you developed early on, and then somebody's like, Eureka, you have this tongue tie. And you're like, wait, what the heck are you talking about?
oh, and it's so interesting. Yes, exactly. And it's been one of the things that I think I wrote to you in my email that just stood out to me as my tongue, because it's not automatic. I was like, I went on Reddit and saw all these people write about how they could feel things in their feet. Like I was amazed by how many people had lives had changed by this Myo stuff and tongue tie release. And more specifically actually is what they were talking about, but I was like, I thought it would just be automatic, but it really wasn't. And so after months and months, it was a very slow every day doing these exercises that when I started to experience it, I was like, oh my God, it feels like sucking my thumb. Like I remember one morning I was like, it's like I have a thumb coming from my throat. And then I remember starting to notice I don't wake up as anxious. And I don't know if that's because we'll get to the sleep apnea part, spoiler alert. But like, I don't know if that's because I have that now, what I was supposed to have, or if it's because I don't have the sleep apnea. So I was grinding because I was stressed out because my tongue was blocking my airway while I was asleep. So I don't know, but that was definitely a big thing. And at the time, I remember because I was a very compliant, good child, I was trying to stop sucking my thumb. And like you said, they didn't. And so they put this appliance that would like hurt my thumb
Yeah.
if I
Tongue,
had
a
to.
crib. You had a crib,
Oh, yeah, a
like a
crib. Is that
pointy,
like, and it felt so archaic and barbaric, like when I think about it now, but that was
Mhm.
the solution. So that got me to stop. And so I just wonder how I compensated, what kind of anxiety, how I dealt with that anxiety. And one of the reasons I want to talk about this is because not only was this journey really intense, in terms of this year and like doing all of this and all of the oral trauma that it brought up that I think is just stored in the body, but also that it's my first experiencing dealing with like a very multidisciplinary integrative health team. I mean, I had the osteopath, I had you, I had Megan, the myofunctional therapist, I had the sleep specialist. Like it was really such an integrative treatment that I was thinking, where's the mental health in this and the anxiety and the ADHD that's highly correlated to all of these symptoms that I would definitely still say I'm neurodivergent and ADHD, but completely, I'm not sure if it's the anxiety or what, but it's much, much better. I'm
Yeah.
much more able to work with my
Well,
ADHD.
I want to buy like a mall like a mall that went out of business, and we just all each have our own little, like, I'd be in where the Gap was, someone else would be like where J.C. Penney was. But if we had like the osteopath, the myofunctional, me, like, and people could pick who they want to go to, like, you may not like the Gap, you may like the Limited, whatever. But I just think if we could all be in one place, because think of how much effort it was for you, but you did it right. And that's what we really stress to people is like, it's never just the structure, it's all the stuff that goes with it. Because to your point about mental health, like, you're a 7-year-old who's sucking their thumb to calm their nervous system. And if we just take that away from you, what does that do to our systems? What does that do to our ability to stay out of fight or flight mode and to be in parasympathetic? And I think so many of us as adult females who are really, like, we're smart people, and we shouldn't discount that. But we've worked really hard to do the things that we do, and what has it done to our brain if we don't have the calming effect of all of the other things? So, I mean, because you started in orthodontics, you moved on to myofunctional therapy, from myofunctional therapy sent to osteopath. And when we started to max those things out, it was kind of like, okay, now we got to talk about the tongue tie release. At what phase in this did you get your diagnosis of, because you were diagnosed with moderate sleep apnea? Like, we're not talking, and for those of you listening that don't know the spectrum of apnea, apnea is based on a number and the number of times your airway stops functioning for 11 seconds or more. There's other numbers that are important to look at, like the respiratory distress index, but the diagnosis comes from this AHI, apnea hypopnea index. And under, but there are certain levels of apnea. And when you are under 15, you're considered mild. When you're 15 and above, you're considered moderate. And when you're 30 and above, you're severe. And there's different treatment modalities that are recommended based on these numbers alone, no other factors. And so you were diagnosed with moderate sleep apnea. You had two studies, is that correct? And both were right in the 17 range.
I had one study. No, I only had one study as far as I know, like meaning I did one study and
Okay.
then I did a post-treatment study
Yes. And then
in
but
December.
it was read by sleep physician. So your
Yes.
AHI was 17.5 events per hour. Your RDI, respiratory distress index, was 21.1. And those are shorter arousals. So your arousals were high, your apnea was high. You desaturated even, so your oxygen was dropping. How did you feel when you woke up in the morning?
So this actually was very funny because when I was at the myofunctional, she was like, it's worth taking this test. It's an extra $400, but I think you might have it because I was like, no, I'm fine. Like I don't have like I wasn't reporting any of the sleep apnea symptoms. But what had just happened was I would wake up early, I would wake up anxious. My cortisol levels were high because I had blood work done. So I know that I wake up with high cortisol and I would immediately go to coffee. It would be like the most exciting part of my morning, the coffee ritual. And just on a whim, about a month and a half before I started myofunctional therapy, so had no idea, just decided to stop drinking coffee. And I was lethargic, I was tired, I was depressed. I was like really going through it. And it ended up going for months actually, because I think my body had not known non-caffeine. I drank Coca-Cola as a kid. Like I think my body just did not know how to be without caffeine. So I think that was actually covering up a lot of the symptoms. And so what would always happen since I was in my early 20s, I remember my sister, boyfriends, anybody hanging out with me would be like, you're always just like falling asleep at like 9 o'clock at night, like so early. And so now looking back, I was always like, oh no, I'm just a morning person because I would get up in college. I started get my roommate, one of my friends, good friends would come into my dorm. She had so much energy. She definitely does not have breathing or apnea issues. She would like wake, she just has one of those great mouths and like, you just know. And so she just like had all this energy and started getting me to drink coffee. Whereas as a teenager, I could not get myself up. I could not get myself to get dressed for school. I would go in my pajamas every single day, not showered because I was so tired in the morning. So none of it ever clicked. Like it just never clicked like, oh, this isn't normal. So I would go to
Yeah,
sleep
you're
early,
you're
wake
just
up
a
early.
teenager. That's just what they do. Like we're so dismissive.
Yes, yes, exactly. Especially in our culture where so many teenagers are unwell. Like you just see them, they're so tired. So anyway, so did I lose my train though? Because I can get off into all these tangents. I
No,
want to
so
the
so
sleep
then
apnea.
you decided to you stopped coffee, and
Yes.
after a month you were like, "Oh my gosh, this is a like a disaster zone."
Yeah, but I could be tired because like a lot of times I'll go through phases where I'm tired and I really honor those energies for me. That's like very important to me. So I just thought like maybe I'm coming down with something, maybe something's going on. I always went first to blood work. I always went first to nutritional deficiencies when I was trying to figure this stuff out. It never occurred to me the sleep because I would fall asleep so easily that I
Yeah.
was like, no, I don't have insomnia. You know what I mean? I don't have a sleep disorder. It just never occurred. And whenever you look up sleep apnea, it's always like overweight, like all of these things that I'm not, unhealthy in some way, like all of it, like no one now when I Google it, because I'll ask in very specific ways, I see more that you can find it. But if I just Googled obstructive sleep apnea, it was like mostly, if you're fat and out of shape is what like it kind of says.
Yeah, same thing with tongue tie. You Google tongue tie, all you see is a pictograph of a baby with no teeth and a tongue tie to the tip. There's no discussion on like adult
Big
tongue
time.
ties, variations in the structure. But think about it, right? Like how long have you been working to preserve your health? Yoga, blood work, eating healthy, moving your body, working to try to get sleep, like appropriate sleep. But when the quality is compromised, which it was for you because you're kicking yourself out of sleep 17 and a half times an hour, like how can you be expected to combat disease for the rest of your life? Like that's the hard part.
Oh,
So,
such a good point, and exactly why I wanted to tell my story. Exactly why,
that
because
gives me
it
chills. Yeah.
adds up. What
It
did
gives
I?
me chills.
I know, same. I feel like we have such a shared collective purpose that makes me feel so good because I'm like, anybody, I mean, I was looking it up the other day, 30% of people have obstructive sleep apnea. I was writing it. I was like, that's insane,
Insane.
insane.
Yep. Yep.
Um,
So you start some myofunctional therapy after stopping coffee.
yeah,
And what did you notice to start? Like you started wearing Megan DeWalt is a myofunctional therapist here locally. She's fabulous.
amazing.
And she loves like she's self states she loves complicated adults. Like she loves people like you who will look at the details and the diagnostics and the numbers and the blood work and watch for change because you want to get better. Like you're motivated to do better. So you're going to put in the time. Like these exercises, they take time. And they're not overly, they're not painful. They're not necessarily uncomfortable, but it's a commitment, wouldn't you say?
I mean, huge commitment. And I have to say, I'm very vain, and like the beauty aspect to it was also very much a motivator for me, not
Mhm.
because of the beauty sleep. Like again, I didn't know, but as I started aging, I was noticing like the patterns of my aging. And I was like, something always about my mouth, or like I would just catch myself in photos when I wasn't posing or smiling, and I would have like a mouth breather face, like the
Yeah.
Napoleon Dynamite sort of like mouth breather face. And
Mhm.
I was like, that's weird. So like that had always bothered me alongside my posture. Like I kind of always noticed these deficiencies, and like
Mhm.
even when I would talk, my upper lip would get thinner, like all these muscle like around, the mouth and stuff like that. So I started to kind of notice that too. So I think that's important because that was a motivating factor for
Totally.
me. Like aging health is a big one for me because I just think I start to see all of my patterns. And so when I started with her, I was like, how do I look better? Like how
Yeah.
much is it gonna change how I look too?
Well,
And
we
I
grew up on like Noxzema pads and tanning beds. Like these kids now have like they're 12, they've got Korean skincare in a fridge. I'm like, well, you're gonna look a lot better at 42 than I do. I don't even think I'm 42. I think I'm 41, but brain health, cognition, it's hard. Ugh.
I am so curious how the young people today will age
Oh
too.
my goodness.
All
Well,
that
they'll
stuff.
have peptides and AI. They'll be fine. So,
Oh
So
my
yeah, I
God.
mean, so you're noticing like facial changes, you're noticing compensations in muscles, and you're right, like our collagen changes over time, and it's tough when you start to recognize that in yourself, and you're like, what do I do now? Like, how do I make this better?
Exactly. And I knew the answer was not going to be like filler for me. Like, of
Oh,
course,
thank
I've done
goodness.
some of that because I need to do like the, and help the collagen and everything.
Hmm.
But I definitely knew that I was like, I've always been that way. And I've always been like, I want to get to the root issue. And so Megan really helps me with that because we started to meet, we started to do the exercises. That's when she was like, you might want to take the sleep study. I was like, okay, I'm just going to trust you. I don't really think I have it. Um, and the exercises were fine at first. They were like, I was like, okay, I'm doing these. They start simple and they get more like gradually harder. So it was an interesting time. And then I was like really excited to be ready for the tongue tie release. I think it was about 2 months in, May, June, July. Yeah, it was 2 months in. And she was like, okay, you're ready. You should schedule this, or maybe it was a month in, but it was 2 months into the therapy that I did the tongue tie release. She gave me 3 or 4 doctors, so it made it really easy. I didn't have to find anybody. That's the other nice thing is once you find one and you're in the network, she gave me the osteopath, she gave me the sleep, she gave me everything. So she gave me you. So
Yeah.
it was really simple. I called a few places. I just liked you. My orthodontist, Dr. Baker, said you had done her son. And she had told me some like traumatic story about a child who had like the release too much done and like the tongue was floppy. So I was really scared of that
Yeah.
too.
Well, and it's hard. I mean, I think at least in our practice, and I think for so many of us in this space, we don't want you to feel because sometimes I'll have like a aggressive dad come in and be like, "What type of kickback do you get?" I'm like, "I don't get a kickback. I just want you to get good care from people I know will do the best job." Like all of us can give you 3 or 4 names. There's plenty of patients to go around. I just don't see why this has to be so territorial. And I think that's the thing. Like Megan knows that, and we all know as providers, like there's a number of us that do this very, very well and systematically and have similar outcomes, great outcomes because we do really look by the book. And so but it's ultimately the patient's choice where they want to go. And so by you calling around and like figuring out what fit you best, like you found us and I'm so glad.
Me too. I am so glad. And I'm so glad I picked you. It was just such an instinctual thing. I just talked to a few people and I was like, yeah, this is definitely the dentist that I want to do this. Um, that's so crazy that guy, that's such a funny, like, talk about that guy would think that. Like, I
Oh
know in
my
my
gosh.
profession, we're not, I don't know how it is in yours, but like as a
Yeah.
therapist, you're not allowed to do that. That's like breaking your code of ethics and you could
Yeah.
be like reported for that.
Yeah, I'm like, I don't need a $5 Amazon gift card to like get through the day. It's not what we're looking for here. We're looking for optimal outcomes, health and wellness, and like doing the best ethical job we can for people. So, it's tough.
Yeah, and your job, like I know I had talked to people who told me they had tongue ties 3 times and never did the myofunctional therapy and they kept getting retied because the
Yeah,
tension comes back, which
yeah.
makes sense because I had so much the stretches. So then we did the tongue tie release and that's when it started to really intensify for me.
Hmm.
It was painful for like the first couple days, but then for a couple weeks after I had to do these stretches 3 times a day. And that brought up so much like emotion for me, like anger and frustration. And it was not like rational. It was almost like it was like in my body somehow. It was very physical. So, but I did it. I did it and I did everything. I was like, and it healed so well. And that was encouraging me. And it looks amazing now. And then the work with the myofunctional therapy post treatment started. I mean, I was doing light exercises during that healing period, mostly stretching. It was a lot though, because my hands, I would have to wash my hands and make sure they were clean and do it 3 times a day. And I had to be in a space where I could do it. And it was painful at first. And then we started to do like some of the exercises. I kept going. I was always looking in the mirror, always like, and throughout that time, I really started to develop this mindfulness of my mouth in a way that reminded me of it because I've been doing yoga for so long and I've been very much into getting into deeper and deeper layers of mindfulness within my own body.
That's
But
fabulous.
yeah, and it's been amazing. But I never even thought about the mouth. And like now it's so funny because I'll hear people mouth breathe and it will make me anxious immediately. And I'm like, oh, that seems so uncomfortable. And I actually had my first cold when January since all of this, and my nose was blocked. And there were two things about that were notable that I don't know yet, but I used to get sore throats all the time. And now this time I didn't get a sore throat. It was all like a lot of nasal congestion and a lot of sneezing, but I did not get a sore throat, which I don't know yet because it was my first time. But I was like, I'm starting to think that maybe that has to do with it too, because my mouth isn't open. And I was able to clear my nose and really focus on my nasal breathing, that even though I was sick and congested, I was able to nasal breathe because it was so bad to mouth breathe. It was so, and now when I work out, I'll like slow down and make sure that I'm not mouth breathing instead of trying to push myself, because I'm like, this matters just as much as
Just as
trying to
much.
build this
Totally.
muscle if I'm not going to do it the right way. Because now I know I can, and should be nasal breathing all the
But
time.
isn't it funny? You think back to yourself, you're like, how did I exist like this for so long? Like, how did I mouth breathe every night and wake up even remotely rested or not extremely thirsty? Or it's so wild when you're conscious of it and then you get sick, you're like, oh my gosh, this is terrible. I can't believe this was my normal. Like,
Yes, I know. I think about that all the time. I'm like, I honestly think the body just gets used to it and dissociates. And I was very uncomfortable in my body as a child. And I don't mean looks wise, because I was fine with that, but very much like I would always feel like static electricity and just like different things. I was very sensitive.
heavy
And
feeler.
so that is part of it for sure. And now it's like, yeah, it's so weird and wild. It's like, what else is like that? It's like,
You feel like your
what do I
nervous
not
system
know?
is just like calmed down a bit. Yeah.
Uh, uh like 100, like I don't, more than 100%. Like,
Yeah.
yeah, it's calmed down a lot. And as you can see, I have a lot of energy and I'm very like here and there and
You're a
whatever.
doer. Yeah.
But yeah,
You're
but
like you
it's
said
calm.
before we got on the call, you're a creative. Like your brain needs power to do what it's designed to do. Like we're all different and you have a certain like light and skill that you want to share with the world, and to be exhausted all the time doesn't aid you at all. So, and remind me, you were not one that had like a dramatic response during the release. Is that correct?
No, that's why for me it was a very slow, and I was
Yeah.
expecting it to be dramatic because I was reading all the Reddit threads and people would be like, "Oh my God, my feet feel light." And I
Yeah.
would hear stories like Dr. Baker was telling me about her son who had it
Yeah.
done, and I was like, "I'm not experiencing any of this." And I'm a pretty mindful person that like I did one osteopath session pre-tongue tie release, and I felt more from that, from the gentle maneuvering than from like like undoing my tongue tie.
Yeah.
Like, so
Well,
no.
and I've started to because of that, because people do have such dramatic responses, we've started to categorize and take surveys on patients after the release because and I'll show some photos in a moment, but so for anybody that's watching the YouTube version of this, you can pull it up. And these type 4, these under the surface submucosal, quote, they used to be called posterior tongue ties. They I don't see as many people have a bigger response in the moment as I do with somebody who has a tongue tie closer towards the tip. And I think the untying of something that's more close to the surface, it can be such a big visceral release because all the fascia kind of surrounding the vagus nerve really lets go. For you, I mean, through yoga, through mindfulness, through osteopathic care, and through not being as tied close to the surface, your vagus nerve was probably in a pretty decently relaxed or stable state going into it compared to others where like in kids we'll see them just like they get really emotional, and then in adults they can often get really diaphoretic, lightheaded, hot. Some people can just start to cry. It's an odd phenomenon and everybody's a little bit different.
Wow, that's so interesting. I was really curious about that. It's nice to have a little more context to that because like I said, I was noticing that and I was like, why don't I feel this?
Hmm. Well, if you don't mind, I'll share my screen
Yeah.
and we can kind of talk through what and I can be pretty verbal about it so people can hear it. But when
Yeah.
we look at your restriction, it doesn't look dramatic on paper. And so I'll bring up a little pointer. I think I've got a little laser pointer here. So but it's looking at the surrounding anatomy that's the important thing. And so for you, when I look at when you lift your tongue, like you've done a great job with myofunctional therapy. And that's the first thing that comes to my mind is this person was committed to the exercises because there's tone and awareness of the muscle and what you're doing with it. So when you open, you're at comfortable mouth opening and you can point your tongue up to your incisive papilla. So your tongue to incisive papilla, when you do that, I see this kind of like invagination in the middle of your tongue from the frenulum. So the frenulum is kind of like your muscles are outpacing the tension in the frenulum. Like your muscles popping out over the frenulum because you've done such a good job with your therapy and you've been fighting against that band of tension. And then we look at the elevation of the floor of the mouth. Your floor of the mouth elevates considerably above your plane of occlusion. And so when we look at what you're doing, you're using all of your strap and auxiliary muscles to lift the muscle of the tongue along with the intrinsic muscles of the tongue. So you're almost using other muscles as crutches, and that's where so much tension can come from. And so I'm really
And
conscious of,
neck issues, right?
yeah,
Like where
for
your neck
sure.
looks ugly and like all weird.
Yep. Those SCM muscles, like sometimes I have people do some movements at times during releases and I can feel one side versus the other is tight. And we can oftentimes see that in the middle of the release as well. And so when we look at your facial strain, you're right, you have a little bit of what we call mentalis strain. I have the same thing. And many of us as females have that, but it's also because it's compensatory facial muscles. Our tongue was doing not as much, and our facial muscles are taking over. You have a beautiful smile, you have beautiful tooth display. And that's why I am also very careful with lip tie releases because we don't want to just release all ties, is sometimes instructions I get from myofunctional therapy. And I'm like, is it a frenulum or is it a restrictive functional issue? And tell me if it is or not, or I'm going to look at where the teeth are and make sure I don't make this person 10 years older than they need to be. Like you have a beautiful smile. And then when you're in your suction hold, so that's the tongue to incisive papilla is kind of how we look at how the anterior portion of the tongue positions. And we almost want it to lift straight up like a surfboard, like so that it can be like one unit and not have too much of a curl. For you, you don't have a ton of a curl because your muscles are just like popping out over it because you did such a good job with therapy. But when you do your suction hold, this tension that we see here on either side of the frenulum, it's like a trampoline. Like that's just again that engagement of all of these kind of sling muscles underneath the floor of the mouth and into our neck. I see a ton of tension in like the levator trap complex, especially in females. I mean, men have it too, but they don't feel it the same way we do. They just walk around with like shoulders up in their ears. And then when we do your release, like the thing that's notable is it's not a big access point, and these procedures don't have to be invasive or dramatic looking to be effective. You're only releasing the band of tension. So for you, the superficial band of tension wasn't a big deal. We could get to it and almost keep that area really teeny tiny because then there's less healing tension over the top of it. Like the smaller the surface area there is to heal, the better someone's going to heal. And then under the surface, releasing into those genioglossus muscles, which in you are a little red because they're so well toned. And you're not a bendy person, are you? You're not hypermobile.
I'm like, I think I'm not hypermobile, but I think I'm on the verge. I once had a doctor tell me that I was like on the verge of like Ehlers down. I forgot
Yes.
what that's called, but
There
I
is
don't
some,
think I am.
and that's might be why like you are a good compensator. Like you made it this far in life without anybody ever bringing this up. But at the same time, you still have enough like strength and tensegrity of your tissues for you to develop good blood flow to this muscle. Like I almost like it when I see a little red versus just like a pink, like kind of dead muscle. I mean, pink muscles are good, but you can when you do enough of these, you can see the difference. Like this to me is a well oxygenated, healthy muscle that is like raring to go. And so when we do the release, what we can start to look at is like, where do your vessels fall? So your vessels pre-release kind of come in right towards the center. There's almost like this 90-degree curve. But then post release, these are really at this like 70-degree angle. And that's kind of what we want to see. Like, that's just that band of tension letting go of everything and not pulling everything so tight to the midline. And then when we look at you post release, your plane of where your elevation of your floor of mouth is, and one day I can do a side by side of these if you ever want it for your book. And I can mark them up too. The elevation of your floor of the mouth has dropped dramatically. Like you're in the same position, same lift, but your whole floor of mouth just let go. And that's where, like, again, for you, you'd done enough work and manipulation mentally and physically that everything that let go on not as visual of a level as people post all over Instagram. But like your symptom improvement has been so dramatic that it really goes to show that little details make a big deal for people's health. And then when we look at your suction hold too, like to me, when I look at your pre, I see there's a slight asymmetry in the way you're lifting. And so I suspect that under the surface, one of the bellies of the genioglossus is going to be slightly tenser and overdeveloped, and one's going to be more like compensatory, underdeveloped, and wrapped up in fascia. And we can see that when we do your release. We can see how the right and the left side are more dramatically different when you're doing your suction holds. And now that the bellies are in a good spot, the genioglossus, which is the extensor muscle of the tongue, and the lifter muscle, it does a lot of different stuff. And now that those are in a more normalized position, you can become more symmetrical as you go back through myofunctional therapy. So that's why we tell people like myofunctional pre and post is so important. But yeah, I mean, and then afterwards, when you're lifting, we can see how kind of normalized these sides are. Like the vessels are lifting more symmetrically. The lift on the floor of the mouth is symmetrical compared to your pre. So, like on the surface, you had a lot of tension that needed to be released. Because see how this kind of comes up like this, and this is more like sloped. You can even see your vessel here. And then when we look here, everything's like boop, boop. Like it looks exactly the same on either side. Like our body wants symmetry. It's just when we have, because the chance that you had a hard birth or you fell off a swing and knocked your head or had some torticollis, like this is all stuff that starts in infancy. These under the surface asymmetries, I suspect. There's trauma, there's birth stuff, there's all sorts of things. So does that help kind of visualize?
Oh my gosh, yes, I'm so glad I got to have this in-depth look at all of this because I kind of knew some of this, but not into this level. This is really
Yeah.
interesting.
It becomes, I look at a lot of tongues, whereas other people look at like a lot of Excel spreadsheets. Like it's the Ocho has like Excel Olympics. We should have like diagnosed tongue ties Olympics or something one day for you,
Well, it's
ESP.
so funny because talk about the vein stuff. Like I
Oh my
never
gosh.
really appreciated how much the tongue has to do with beauty because even now the way I'm swallowing and everything, I can feel that it's changing the way I use the muscles, like you were saying. And so, but even more than that, when I first started doing these pictures with Megan, I was like horrified. I was like, my tongue is disgusting. It's like
I always
black
see
and
like my
blue.
mustache and like nose hairs. I'm like, ooh, that needs to be cropped.
No, that was like the least of my problems. I was like, why does it look all veiny and blue? And now, and she would show me her tongue because she would be trying to show me how to do things. And I'm like, hers looked so like lean and like clean. And now the bottom of my tongue looks completely different. The
Yeah.
backside,
Well,
all that
think about it. I
tension is
mean,
gone.
it's her job to tone that muscle all day, every day. A toned muscle. And I'm always careful when I talk to families of young children to bring facial aesthetics because, like, they know in their heart they want their kid to be good looking. And I'm leaning into function, health, breathing. And I'm like, and there's also a really positive side effect of facial aesthetics because if you have cheekbones and you have a jawline, you're actually more likely to get hired for a job than if you have a narrow mouth and you look like a rat. Like there are actual studies that show that people with a narrow arch form are less likely to get hired because they look like a rat is the scientific explanation that is given in the paper. Like
Wow.
it's a beautiful face is a foundationally healthy face. And you look at Julia Roberts and you look at some of the actors today, you look at movies from the 1930s, like people have different jaw structure. We are outpacing genetics with, I think in part it's the foods, in part it's the air we breathe, it's the prevalence of tongue ties, it's our ability to continue to keep people alive from a really early age when in the past we didn't have as many medical interventions to keep somebody with us. Like it's kind of a dark subject, but our we can keep an infant who was born at 24 weeks alive when we couldn't 100 years ago, like for sure. So it's just different approach to health, and just because not everybody knows about stuff doesn't mean it doesn't deserve treatment. So you've had your repeat sleep study. Where are we now? What are we looking at today?
Wait, I just had that was so you just yeah, what you just said was I just have to address that because
Sure.
that's exactly it. Beauty is functional. And I did not really realize that. Like I would look at my mother and like now, especially as I'm older, it was like I was seeing all of those unwell patterns in her and not and being like she's like I would like look at her beauty and I could see and it's not that she's beautiful. There's such beautiful genetics in my family, but there is a lot of malocclusion and a lot, and I know she has a tongue tie, and it's unattractive in the way that like my sister, part of the trauma is my sister would always yell at me. My sister doesn't have this. She has a different dad too, but I don't know. She doesn't have the issues that I have, but she would always yell at me that I was eating with my mouth open and I had like chronic PTSD and so much shame.
Well,
And
it's
like,
embarrassing, right? I was
yeah.
really shy growing up, like painfully. Today, it would likely be diagnosed as selective mutism. When I was in a group of people, I would not speak. And in part, it was because I don't feel I was a good communicator. I still am not. My husband calls me Maine Marble Mouth. But I grew up being asked what all the time. So at some point, you're just like, it's like embarrassing to talk. Is it shameful to talk? Is it just hard to talk and be understood? And I see that in a lot in children where they're embarrassed about the things that are going on and they don't know how to talk about it or vocalize it. So for you to even bring that up, I mean, it just brings up a lot of childhood stuff, I hope, for people listening. Like, no one's alone in this.
Yeah. Yes, exactly. So you've had similar experiences, which is so crazy when you say you're not a good communicator,
Oh,
because
yeah.
I've listened to your podcast. You're amazing.
Well,
Like,
now
and
it's like verbal vomit because I just don't know how to turn it off. But I think it was from 12 years of not talking. So here we are. No
I can relate to
filters.
that. I can totally relate to that with not being a people pleaser anymore because I used to be such a people pleaser. And
Yep.
now it's like the opposite. I'm like,
Yep.
I'm not doing
Still a
anything.
work in progress here. Still a work.
Yeah, still a work in progress for
Yep.
sure. But yeah, so I just wanted to say that yes, functional is, and now I've realized that so much as I've gone down this rabbit hole and looked at skulls and, to speak to what you're saying about the changes, it really, what I keep reading, and I wonder if this is true or not, is that only in the last few hundred years, pretty much in line with the Industrial Revolution and industrial society, is when we start to see malocclusion. Up until then, all teeth are perfect. The only thing they saw was chip teeth, probably because they were being used so much. But then you also bring up a good point that people wouldn't have like lived as long, and so now we have these ailments. But one of the other things that I read about was that in the 1800s they were doing a lot of surgeries, and back then they were doing tongue tie surgeries, but because they were doing so many other surgeries that were bad or didn't have good results, it kind of got like swept in that. And then by like the early 1900s, there was like a backlash and people didn't want to do tongue tie releases
Yep.
anymore. That was
And then
like
they
one
also
thing I
are like,
read.
formula is better for you. Drink fortified formula. Breastfeeding's bad. So like you're not the only one with pre and this is what I try to explain to parents is like, this isn't new. Your grandma likely had two teeth pulled because her jaw had changed dramatically from her parents. Like premolar extractions were common, and sadly they're still commonplace because we're getting to the orthodontist too late. And if we don't, as an orthodontic and a dental community, encourage looking at the timeline of development, we're going to miss the window of opportunity for less aggressive expansion than we have to do on adults. And so, yeah, premolar extraction still exists. The option for expansion should be given to everyone when we suspect there's not going to be room for the teeth. Because that's what I tell kids all the time. I go, can you believe that your nose is connected to your upper teeth? And they're like, no. And I go, what do you like better, breathing through your nose or your mouth? There's no wrong answers. And then they all just go, they kind of look at their parents and they just, with shame, like point to their mouth. I'm like, that's a good answer. Not always the right answer, so we'll work on that. But the kids are really brutally honest at times. But yeah, I mean, the roof of our mouth is the floor of the nose. If there's not room for the teeth, there's not going to be room for breathing the way it was designed to be. So, and
Yeah.
that trickles down to sleep studies. That's why your RDI was high. You likely didn't have sleep apnea 20 years ago. You had disrupted sleep that eventually became obstructive apnea because there was not room for the tongue. The tongue wasn't toned. The body's ability to combat stress, nasal resistance can cause it all too. And that's why you started to feel this tipping point of symptoms too.
Yeah, yeah. And I should note that I had rhinoplasty at age 17 because I had a deviated septum. And then I also like, oh, well, I'm gonna have like again the looks. That was like the one thing. But they were trying to figure it out because I could tell like when I would run, I couldn't breathe. Like I would get like a pain in my like side. And I was trying, so they thought it was the nose. So even then, so I'm wondering, is it a standard of care now to give that option to expansion? Like how do how widely known is this? Like it feels like it would be like bad malpractice to not be doing that.
Sadly, a lot of my colleagues and who have become dear friends in this community, we have different directions we grow. We have a side to side, we have a forward. We can't always expand our way out of every problem. And so expansion's on the table. Expansion while growing allows for as much forward growth as possible. And oftentimes, forward growth can't be obtained without surgery. So I feel strongly it should be standard of care in our orthodontic community to take a look at where does the jaw sit and where should it be and how wide is it and how wide should it be? And there's no blanket number. Everyone always wants a number. Everybody's different. We've got people that are 5'2" and we've got people that are 6'4". There has to be a relative norm though, and ultimately the teeth should fit and they should fit in a position that allows for open airways. So I feel strongly it should be standard of care to have a conversation about expansion. Ultimately, if somebody declines it and doesn't want to do it, that's on them. But for you to hear your story and say like, I was just told I needed four teeth pulled. There are still people out there where that is the only option given. And part of it is because we're not willing to be wrong as medical providers and we're not willing to do the hard work or make referrals when it's not our skill set. Adult palatal expansion or expansion over the age of 14, 15, it's oftentimes bone born and not everybody has that skill set or is willing to learn it. Or they're still trying to debunk the fact that the science exists, that it actually works. Like we can get true and stable expansion when we do it bone born. So I think it's just a lot of egos in medicine, and why can't we all get along is always my answer. We're not the best at everything. Like let's all work together so we can do the best for our patients. So you've had
Wow.
your repeat sleep study, and where are your numbers, and where do you feel
So
you
that's a good question. I'm meeting with Megan for my last session. It was like a 12 session thing that was spaced out over the course of the year, basically every 2 weeks. Sometimes it was longer, depending on what. And I would do the exercises in between. That's kind of how it worked. And so I just took the sleep study. So I haven't seen her, and all I saw was that the doctor said you don't have sleep apnea. So I didn't read the actual study, so I have no idea where the numbers are.
Oh, that's
So we might
amazing.
need to edit that
But on
in.
paper, like the sleep apnea is gone
Yeah.
and you feel
And
better.
in the way that I feel like
Yeah.
so now I can tell you I do not fall asleep at night. Like it's so weird. It's like it's such a like this was who I thought I was, and
Mhm.
I really haven't been. I might it like all makes sense. I don't wake up in the middle of the night as much. Like I noticed that I was waking up at like 3, 4 in the morning. I still do occasionally, and depending on where I am, different things going on in my body, but much less so. Um, and it's also different because I'm not depending on caffeine at all. I'm off caffeine for the since March
Wow,
31st of
that's
last year.
incredible. Good for
Yeah.
you.
So I
Well,
just feel like a different person.
and I tell people like we're not treating to numbers. We're treating to symptoms because if If you have somebody, and I see so many patients that come in and they've had their first sleep study and they go, I'm exhausted, and everyone tells me I don't have apnea. And I go, well, you're symptomatic though, and you have an AHI of 4. Just because it's not 5 doesn't mean you're not symptomatic with the way you're breathing. So what else can we do for you? And that's where we start to look at, like, we need to be really patient dependent and not so numbers driven, because we're just not going to make people better. Well, I just so appreciate you sharing your story. So what does the future hold for you? What are you working on now?
That's a great question. I mean, I definitely, it's definitely informed my whole idea of anxiety. And when I start to see in my patients some of the symptoms, I'm like, you should just go get a sleep study if you're falling asleep or you need to take naps, or like I can start to understand, like I'm like, oh, like I can start to think like maybe this person has a tongue tie. I'm definitely not qualified at all to be able to tell, but I'm starting to just like bring it up. And I want to write this book because I feel like so much of the books that I've seen um, talk about development, which I understand why, but I'm really interested in aging health and how this is affecting the plastic surgery procedures that people are choosing to do and why they don't look good because they're not addressing the underlying functional health. So I really want to bring those disciplines together.
We need
Studying the
it.
face. We do. And like,
Yeah,
even with the mind body, it's always about the mind body connection. Where is the face in all of
for
this?
sure.
Like,
Well,
it's
and you're a therapist by trade.
yeah.
Like, that I've been on like a trauma kick for a little while. I think it's because I realized, like, I have like a ton of underlying. I mean, part of it was like just being a shy kid and like being stepped on for gazillion years. But and then ADHD, all the things. But two of my favorite books, The Body Keeps the Score and The Myth of Normal, like, there are so many times where I was like, I just want to like write an addendum to this chapter to be like, okay, but also breathing, because we're not like, those are incredible books, but they don't talk about these things at all. And but then we talk about these things and nobody's talking about the mental health side. So that's where I think that, I mean, what you're going to put out into the universe is going to be so impactful for so many, because people are going to hear their story in it. And I hope people listening to this hear it, because I mean, I hear that from patients all the time. Like, you're in parallel with so many people that we treat. I think adult females are my favorite patient population. And children I love so much because we can make so much change, but adult females are just motivated to get better. It's like, how can we actually not cut corners to our health and make it so that we have like the most fruitful feeling life moving forward. So it's really
Oh,
fun to work with people like you.
well, thank you. It's really, I couldn't do it without you. And that's like literally because I wouldn't be able to untie my tongue, but even the emotional, the support, the education, like the whole process of it is such a like relational experience. Because even if you were like thinking about some of the male dentists that I have, and I'm not hating on males, but just my experience with trauma and dentists have been males, and just the way that they've like just been so dismissive or harsh, or so I feel similarly about female
Yeah.
practitioners
Yeah.
actually.
My dental we're all females. We
I
have
mean, like,
one male assistant. He's the best.
and like to me, like it's so funny because people would talk about like sexual trauma and going to the gynecologist and like that. And for me, it was always the dentist and my mouth trauma. Like, and I was like, there are holes, in your body that like, and to me, like the mouth symbolized that. So I had a lot of trauma. So I think there's another aspect to it of the nurturance of females. Like, I remember early on in Megan's office, I almost like cried. Like, she brought me the tissues because I was like so upset about thinking about this whole life of like pain that I had from all these different reasons and the trauma, like you're saying. And she just handled the emotional part so well. And it's such an emotional thing going through this process and like really addressing it as opposed to just ignoring it and like not dealing with like that it brought up a whole lifetime of trauma, really.
For sure. Well, I really appreciate you
Yeah.
saying that, because I feel the same way. I mean, I think we stay so siloed in the medical community, and I just see how that impacts a patient's feeling of autonomy, and if you can't treat people with empathy they deserve, then I just don't think we should really be treating them. It's tough. So, well, I so appreciate you sharing your journey. Is there anything else that you'd like to share? Like our podcast it's the day doesn't go by where someone goes, no one told me. And so we assumed that name just because it was like such an eye-opening statement because we hear it so often. So like, nobody told you a bunch of stuff in this journey, it sounds like. Is there anything that you can give people listening that they can take away and kind of think about for themselves?
Yeah, I really appreciate that question. And thank you. Really, the pleasure is all mine for giving me this forum, like this platform to be able to tell my story. But I think the message that I really want is like, you may not have sleep apnea, you may not have the issues that I had, it may not be a tongue tie. But how do you learn to trust your own journey and follow the clues to your wellness when something inside you is telling you this isn't right and has been for a long time? And of course, timing and unfolding and relationships have all to do with all of that. But how do you continue to stay open, to trust yourself and to follow that, to make your body better? Because like you said, I have a lot of work to do in this life and I need a strong body to do it.
Yeah, we got to trust our gut. Like whether you're a patient, whether you're a parent, like you got to trust your gut because you don't got anything else. It's tough.
Exactly. And not just trust it, but take up your own authority, because that's, I think, something in the medical community. Like people are always looking to give their authority to the doctor. And it's like they are an expert to work with, to understand the expertise that they have, but no one lives in your body. And you're gonna find, like it's like you said, you're gonna find different doctors who have different philosophies. I personally think this should be in the orthodontic, like that this should become standard of care for orthodontia in general, but whatever, that's a whole other
Slow
issue.
road, but we're making progress. Well, I
Well, let
mean,
me
there is
know
a
if I
study
can.
that says the patients that ask the most question and take the most autonomy of their health are the ones that get the best outcomes. Like those that write the emails, those that ask the questions, those that get multiple opinions are going to get better care. And like we should all be that way. We deserve it as humans, and we have the ability to make choices. So, but you can't do it if you don't have
Totally.
the information.
Exactly. And it's a skill that you develop that I've been working on for decades,
People
for
pleasing.
sure.
Yeah. Hmm.
Yeah, exactly. Not fawning and people
Yeah.
pleasing. Totally.
Mhm. Well,
Well, thank
Emily, thank you.
you.
This has been such a joy. I really appreciate you. And I am
Likewise.
so excited to, when this book is launched, you keep us posted and we'll do a repeat episode. And I really value you sharing your journey because that's what makes a difference for people moving forward. So thank you so much, everyone, for joining us on this episode of No One Told Me the Airway Health Connection. We look forward to seeing you next time.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
want to learn more about airway health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram at Untethered Airway.
Until next time, bye.